In today's video, we're going to go over the most common myths regarding ACL injuries and ACL surgeries. My name is Dr. Marco Lopez, doctor of physical therapy and certified strength and conditioning specialist and co-founder of the Basketball Doctors. So let's jump into it. We're going to go over our first most common myth, and that is whenever you have a knee injury and you hear a pop, it's your ACL. So that is a very common question we get. People injure their knee and they hear a pop, they're like, oh, it's my ACL. But it's not, a pop is a common symptom with an ACL injury, but there has to be other things involved. So one of the other things is that the knee itself has to go into some hyperextension or some valgus force, and usually there's some swelling right after. So just hearing a pop after you just, get up from the couch or do certain movement doesn't automatically mean it's an ACL. Also, with the pop, it's usually a noise from a ligament or some other structure within the knee, and there's several other ligaments besides the ACL. So we have in the inside part of the knee, the MCL, the medial collateral ligament, and that would go more with that valgus, so the knee coming inward as well. So when the knee comes inward, it not only could be your ACL, but it could be the MCL instead. Then in the outside, we have the lateral collateral ligament. So instead of your knee coming inward, if it goes to the outside, that's more that lateral collateral. Then we have the PCL. So instead of that hyperextension valgus, it's usually the opposite motion for the PCL, the posterior cruciate ligament. Then we also have our kneecap. So if we dislocate our kneecap, we might hear a pop. The kneecap might actually dislocate, and there's a ligament there, the MPFL ligament, medial patellofemoral ligament, that will get disrupted, and you might hear that pop itself. And then you also have the actual structures within the knee joint. You have the meniscus. So it's very common when people tear their ACL, they also tear their meniscus, or just overall when you have some kind of valgus and rotational force, you might hear a pop, and that's more than meniscus. And there probably will be some swelling right after as well. And the last one that normally a lot of people hear a pop sometimes is when they have some kind of cartilage injury as well. They might hear that with a rotational force as well. So when a pop is heard and you have a knee injury, it doesn't automatically have to be an ACL. It has to be accompanied with some valgus or hyperextension movement or a little shift there. So first things first, you got to find out if it was a fracture, if you had this knee injury, and then after that, an MRI will really determine if your knee injury is an ACL. So number 2 myth that we have for today is if you tear your ACL, that you need surgery right away. And that's one of the most common questions I get, like, hey, they're thinking about surgery right away once they find out they tear their ACL. But in reality is you have time. It's not like a tendon tear. If you tear your tendon, let's say your Achilles tendon, and you always often see this in the news, the athlete tears their tendon and then they have surgery the next day. That's because tendon tears and ligament tears are completely different. The tendon itself, they're not going to replace the tendon, they're going to suture it. So the longer you play or the longer you move without the surgery with the tendon tear, it's going to make the repair harder and harder. Versus a ligament, they're actually going to reconstruct this ligament, especially for the ACL. So you actually, when you have this ACL injury, sometimes the ACL injury will have something else with it, meaning like a bone bruise, a meniscus injury, or a contusion, or MCL. But the reason I say that is because you want the knee to just calm down before you have surgery. So a lot of professional athletes tend to sometimes have an accelerated, surgery. However, if you see it, it's usually still at least 2 to 4 weeks. So they're waiting anywhere between those 2 to 4 weeks for that knee to calm down, then they have surgery. For a normal athlete without a strict guideline, sometimes you see people up to 2 months to have surgery. The reason why is we've seen in research that for the knee to be in a quiet position, meaning like there's no swelling, good range of motion, the knee has to go through those phases around, those 4 to 8 weeks in order for it to be best prepared for surgery. Because if you go into surgery with the knee that is swollen, range of motion is limited, your recovery is going to be much harder. So normally right after you tear your ACL, you want to really start rehabbing your knee, start getting that swelling to go down, start working on that range of motion and activating the quad. That way, the stronger you are going into the surgery, the easier the recovery. So right away, after you have that ACL tear, you don't have to jump into surgery, just start getting that knee moving. The last myth that we're going to go over today is, and it's a very common one, is that surgery automatically fixes your ACL and your knee. So that's a big one because people are always like, hey, once I get the surgery, I'll be ready to go. But in reality, the surgery is only the first baby step. The rehab, I would say, and I would argue, is way more important. The reason is that with the ACL surgery itself, they're going to reconstruct the ligament. So they're going to grab a piece of your quad tendon or patellar tendon, hamstring, or a cadaver. They're going to reconstruct that ligament. So now the true healing process starts, and that's where it takes anywhere between 10 to 12 months. First of all, after that surgery, your knee's going to be swollen. So we got to decrease that swelling. Second of all, you lose a lot of muscle. You lose your quad muscle, hamstring muscle, calf muscle. So you got to build all that back up. Then, because it's a ligament, it provides stability to that knee joint. You also have to work these receptors, these dynamic stabilizing receptors, for you to make sure you trust your knee in space. Then you also have to follow the tissue healings. Because they reconstruct the ligament, it's not your own ligament. There has to be a process called ligamentization, where that patellar tendon or quad tendon or cadaver, whatever you chose as a graft, has to now turn into a ligament. And that really starts to start healing around that 3 to 5 months, but it takes up to 9 to 10 months for that ligament to really go through that whole ligamentization. That's why you have to wait at least 9 months to get back, because that ligament is still not fully incorporated as your own ligament until the 9 months. So whenever people mention, having surgery as, hey, I already fixed my knee, that's only the first step. We have to go through a rehab process. And that's why I tell people finding the right rehab provider is, I would say, even more important than finding the right surgeon. You find the surgeon that you're comfortable with, but finding the provider for your rehab is even more important, because they're going to be with you for 12 months. That way, if you guys have any questions regarding ACL rehab, send us a DM. We also work with people online and in Southern California to help with people throughout this process after surgery. Hopefully you guys enjoyed this episode of Mythbusters. We went over these 3 myths that we most commonly get regarding ACL injuries. The first one is a pop. If you hear a pop with your knee injury, doesn't automatically mean it's an ACL. There's several other structures that we went over. 2, that you need to have surgery right away. We actually encourage people to take their time, let the knee calm down before you decide having surgery or not. The third one is that surgery will automatically fix your knee. Surgery is just the first step. The rehab is much more important for sure. So if you guys have any questions, comment below. If you guys want us to cover any other topics or any other myths, comment below as well. Share this with friends and family. Hit the like button and follow our channel. We are the Basketball Doctors. Let's ball for life.